The reduction and elimination of disparities in health is something that we've been trying to do at least for the past 40 years. I'm not sure how much progress we've made. And we talk about the differences. We've improved the health of our minority populations, but we've improved the health of all of our populations, and the disparities between them are still there. It has to start with education. It's about education, education, education.
It's multifactorial. You have to not just deal with someone's health, someone's educational level, the environment in which they live in, their socioeconomic situation, many factors.
That's a question that has multiple answers, and I think health disparities has a lot to do, even beginning with the way we train medical doctors. In the sense that when you come to medical school, you have 25 years of age, and with that you carry sometimes gender and racial opinions, which sometimes are very hard to remove by the time you're 25. Second, sometimes what happens is that it's not all absence of health care. It has a lot to do with the system per se. Long lines, people with the wrong language, people with the wrong attitudes, forgetting that when you're a minority, your honor is more important sometimes than your life. So if you're not treated with respect, you will not in turn come for treatment. The other thing that I think is important is the absence or the presence of healthcare insurance. That is going to be crucial for at least for the people to have something by which they can go visit a doctor or see a nurse or a nurse practitioner. That is not available in all our country. And more than anything, I think it has a lot to do with people have sometimes fear of the system.
The issues of how the neighborhood affects children is quite significant and profound. The ability to play in the neighborhood, the ability to walk, the ability to make healthy choices in a neighborhood, to feel safe and comfortable, is all part of the challenge of solving the overweight and obesity problem in this country.
Better targeting our focus on the cultural aspects as well as the health literacy aspects are extremely important.
The key challenge there is recognizing that some groups in the United States, people in inner cities, people on Indian reservations, don't have equal access, and they're not going to be able to take advantage of the great progress that we've made in medicine and public health in this country. So we need special attention to get to the people who most need it.
It takes the entire community, the business community, public and private sectors. Government has a role. Each individual has their own role.
Well, without question, disparities and the childhood obesity epidemic are concentrated in lower income communities, communities of color, and geographically isolated areas, whether that's inner city urban areas or rural communities in the South. We must make extra investments in those communities to help those families. Doing the same thing for everybody is not going to address the determinants of health that have led to poor health outcomes for our most vulnerable citizens.
I think it's important to engage multiple stakeholders. So it's not just a healthcare issue, but it's an issue for our transportation, for our city planners, for our educators, that sound policy for transportation is good public health policy. Sound policy regarding education is good public health policy. So what's key is involving the stakeholders to work in a concerted effort to address all of the social determinants of health to reduce childhood obesity.
What's important is for us to first of all recognize the issue, recognize the problem, and then to map a strategy, a comprehensive strategy to address it. I think these ad hoc kinds of activities would not get us to the point of solving the problem.